No worries, I'm going to give you 5 tips that everyone new to Medicare should know. Hi, my name is Janine. I'm your Get Set Up Guide and your Medicare expert. Let's get started. Tip number 1. What is Medicare? Medicare has different parts to it. It has Part A, Part B, Part C, and Part D. Part A and B are what's considered original Medicare. Those are going to be administered by the Centers for Medicare and Medicaid Services, which is also called CMS. Medicare Part A is going to be hospitalization, skilled nursing, hospice, home health care, things of that nature, all fall under Part A. Part B is going to be your medical services, doctors, tests, durable medical equipment, ambulances, all of those things are going to fall under Part B, as in boy. Part D and Part C are both administered by private insurance companies. Part D is going to be D for drugs. Part C is going to take your Part A, your hospitalization, your Part B, your medical, and sometimes your Part D, and put them all together into one plan. Part C is also called a Medicare Advantage plan. So now that you know what Part A, Part B, Part C, and Part D are, let's talk about your second tip. Your second tip is, when do I enroll? Your initial enrollment period is when you're turning 65. It's going to be the 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. Within those 7 months is going to be when you're going to want to enroll into Medicare without having any type of late enrollment penalties or anything like that. Now, if you decide that you want to work beyond age 65 and you want to continue to work and you have employer coverage, which is just as good as the coverage that Medicare offers, which is called creditable coverage, at that point, you will have what's called a special enrollment period. The special enrollment period allows you to sign up for Medicare without any late enrollment periods because you have had coverage that's just as good as Medicare's. And so you have your initial enrollment period and you have a special enrollment period. You're going to want to make sure that you sign up during one of those times, because if you don't, you can sign up later under the general election period, but you will have that late enrollment penalty. Tip number 3. What is this? Medicare Advantage, original Medicare, Medicare Supplement, all of those things. What does that mean? So we're going to talk a little bit about original Medicare first. Original Medicare is Part A and B, again, your hospitalization and your medical. The thing about original Medicare, you have copays and you have deductibles, but there is no maximum out-of-pocket. So if you have a really bad year, your medical costs can continue to grow and grow and grow because there is no maximum out-of-pocket when you're dealing with original Medicare. That is why many people choose to have either a supplement plan or they choose to have an advantage plan, because both of these are going to offer you a safety net for your Medicare. First, let's talk about the supplement plans. Supplement plans, I like to tell people, are kind of like a pay up front. Once you pay that premium, you're going to not have a whole lot of copays or out-of-pocket costs at that point. You're going to have some copays, possibly. You're going to have to pay a deductible, possibly, but you can kind of better budget with a supplement plan because you kind of know what your costs are going to be. With a Medicare supplement plan, you're going to have your original Medicare card, you're going to have your supplement card, and you're going to have a prescription drug card. Those is kind of a build your own. You can choose what company you want for your supplement plan, and you can choose what company you want for your drug plan. They don't have to be the same company. You decide what's best for you. With a supplement plan, also, there is no network of doctors. If they are going to accept your original Medicare, they will also accept your supplement plan. So that's one way that you can get help. The other way is called the Medicare Advantage plan. The Medicare Advantage plan takes your Part A, your Part B, and your Part D, and possibly your Part D, and it puts them all together into one plan. So you can't choose what your prescription drug coverage is going to be for the most part. If it has prescription drugs, you're going to have to take whatever that plan offers. With a Medicare Advantage plan, you could possibly have deductibles and you could possibly have copays also. But it's more of a pay as you go. So as you utilize it, you'll have copays and you'll have deductibles. But another thing about the Medicare Advantage plan is it is going to have a maximum out of pocket. That means that once you've paid that maximum out of pocket for your medical costs, then the insurance company is going to cover you at that point at 100%. So that's your original Medicare, that's the Medicare supplement, and that's also the Medicare Advantage. Tip number 4 is you want to consider what your medical costs are going to be. I know it's hard to know what your medical costs are going to be because you don't know the future. So are you the type of person that you are interested in being able to budget what your expenses are going to be based on paying up front with the Medicare supplement plan? Or are you the type of person that says, I would rather wait and figure out pay as I go? If I need to pay it, I'll pay it. That's the Medicare Advantage plan. But have a sense of what your medical costs may be and how you want to handle said medical costs, whether it's through paying up front with a supplement or paying as you go with a Medicare Advantage plan. Tip number 5, get help if you need it. There are state health insurance assistance programs that can help you. You can get in contact with them for unbiased opinions. You can also call Medicare or get in contact with Medicare. 1-800-MEDICARE or Medicare.gov. They can also assist you. And finally, you could talk to a trusted advisor. I want to give you a quick tip with trusted advisors. It's good to consider trusted advisors that work for different companies. So that way you can kind of have like a one-stop shop. And they can give you the best plan that's out there for you as opposed to the best plan that a particular company offers. So that's something to consider. Something else to consider do they have any kind of reviews? Google reviews, Better Business Bureau review, say that 5 times fast, or anything like that. Do you know anyone that has utilized their services that can refer you? Those are just some quick things that you might want to think about as you are looking at advisors. So, tip number 1, know what Medicare is. Tip number 2, know when you need to enroll. Tip number 3, know the difference between the 3 and what makes the most sense for you. Tip number 4, consider your health costs. And tip number 5, get help if you need it. So it has been my joy to be here with you today, and I look forward to talking to you in our next class. Thanks. Have a great day.